Dental clinics above $70,000 a month. If you're stuck chasing one-off emergency patients instead of high-value treatments, listen closely. We guarantee to consistently book your clinic out 2 weeks in advance with high-value implant, cosmetic, and orthodontic patients, or you don't pay us another cent. No awareness campaigns, no vanity metrics, just booked chairs. Now, you might be wondering how we can make a guarantee that bold. It's simple. We've already done this repeatedly for clinics just like yours. For example, one orthodontic clinic we worked with scaled from 20 booked consults per month to 60 booked consults per month in under 6 months after launching their first location. Another clinic doubled their organic high-value treatment inquiries in 90 days after launching a fixed price treatment offer using the same system. And a multi-site group we work with has scaled from 3 clinics to 5 across the East Coast using predictable owned patient demand. And this work hasn't gone unnoticed. Our campaigns have been recognized as finalists across both the Global Search Awards and the APAC Search Awards, competing against the largest healthcare agencies in the world. And if you're sitting here thinking, I know the biggest bottleneck in my clinic is not having a predictable supply of high-value patients. I know I'm fully protected because if my chairs aren't booked 2 weeks ahead, you don't get paid, and now I can see this actually works. Then click the button below and book a strategy call. Now, if you're wondering why most dental marketing fails in the first place, here's the real reason. Most clinics are engineered to attract emergency patients. Someone in pain, someone with a chipped tooth, someone who needs immediate help. And while that sounds good on the surface, it creates 2 critical problems. Problem 1, unpredictable. Emergencies don't happen on schedule. That means your revenue becomes lumpy, reactive, and impossible to scale. Problem 2, it's low value. These patients come in once, solve the problem, and disappear. No ongoing care, no long-term treatment plans, no patient lifetime value. And because every clinic is chasing the same low-value emergencies, you end up overpaying to acquire the least profitable patients in your practice. But the biggest multi-location clinics don't play this game. They focus on patients who need treatment all year round, stay for years, not one visit, and generate long-term predictable revenue. Implants, veneers, braces, aligners, cosmetic dentistry, and that's exactly what we do. Instead of fighting for your one-off patients, we install our long-term treatment magnet, which attracts only high-value evergreen patients actively researching long-term dental care. Here's how it works. First, positioning. We position your clinic as the obvious authority for long-term high-value treatments in your local market, not just another general dentist. Second, multi-channel demand capture. We intercept patients across Meta, Google, and organic search before they've made a decision, so by the time they contact you, they're already pre-sold on why you're the right choice. Third, full funnel optimization. We don't just generate leads. We optimize every step of your patient acquisition system, from landing pages to booking flows to confirmations, so more inquiries turn into actual book consults. The results? Clinics that work with us don't just get more leads. They get predictable chairs and chairs patients every single week. So if you're ready to stop fighting for low-value emergency patients and instead install a proven scalable system that brings you high-value long-term dental patients on Autopilot, click the button below and book your strategy call. And remember, since we guarantee your clinics will be booked out 2 weeks in advance, you carry literally zero risk. It's hard to say no, right? So if you're ready to finally install a real growth system instead of another marketing experiment, click schedule call now.